Okay, so does anybody here have seizures? Been diagnosed with seizures? Know anybody that's okay? Most of the time, seizures can be controlled by medication. The people that have a history of seizures are pretty aware of it. They're pretty compliant with their medications. But sometimes things can happen where they don't take their medication, and so once they get out of balance, they're more likely to have a seizure. Or sometimes we have patients who are having first-time seizures. It's the first time that they're aware that there's a problem. So what a seizure is typically going to look like is it's going to be some type of uncontrollable, really violent shaking to the body. It could be just a body part. It could be just an arm or a leg or one side of the body. Most typically, it's going to be the whole body. And it's hard to really describe it other than the muscles can clench up, the arms can shake, but really what they're going to be doing is they're going to be laying on the floor, they're going to collapse, and they're really just going to be doing kind of a fish flop, for lack of a better word. I mean, like a fish out of water. It's just a real uncontrollable shaking that goes on. From 30 seconds to a couple of minutes, just depending on how bad that particular seizure is. So outside of calling 911, there are two things that we most commonly see that people want to do in that situation that we want to encourage you not to do. The first one is to try to do something to prevent the seizure. Don't bear hug the patient, grab the patient, pin them down in an effort to protect them or get them to stop the seizure, because they're shaking pretty violently, and if you put too much resistance on them or pile on top of them, you're going to run the risk of them really hurting themselves or hurting you. So don't try to stop the seizure. The second thing, and we were talking about it with this last situation that she was speaking of, is do not put anything into their mouth. They used to teach in the class to put a spoon or a tongue depressor or something in the mouth, because we don't want them to bite their tongue off, because they can clench down, and there have been cases where they've actually bit through their tongue because they're seizing so violently. But the greater danger is to obstruct the airway, to block the airway so that they're not breathing. And by putting something in the mouth, putting a spoon, putting a tongue depressor, there's a greater chance that we're going to push the tongue back into the mouth and actually close up their airway and cause them to suffocate, blocking their airway with their tongue. So don't put anything in their mouth. You might be trying to help them, but you're actually doing more harm or possibly causing more harm. So really the best thing that you can do if there is a seizure and that person's on the floor is to give them space and make sure that they are not near anything that can hurt them. So if they collapse right here, the biggest thing we would have to worry about would be the table and the big table here. Because if they're shaking violently and uncontrollably, their head could be slamming into the corner of the table, it could be slamming into the corner of the chair. We want to try to protect them from the objects that can hurt them for as long as the seizure lasts. So the objects that you can move, try to move them out of the way. Otherwise, try your best to bring the patient away from those objects so that they don't do harm to themselves. And it's best to try to keep them on their side. That might be hard to do because, like I said, they're going to be shaking. But you might want to try to keep them on their side, so if they vomit or if something happens that we try to keep the airway open, if they're not on their back swallowing whatever they could be spitting up. So there's really not a lot else that you can do other than calling 911 to really help somebody with a seizure, other than to keep them safe while the seizure is going. When the seizure stops, because eventually it will stop, if it stops before 911 shows up, that person may not be of their right mind for a couple of seconds up to a couple of minutes, because when you're seizing, they're not necessarily breathing regularly, and so there could be a lack of oxygen that's gotten to the brain during that seizure. So it takes them a little bit of time to regain their normal level of consciousness to be able to start talking, answering questions. So again, it's just important to kind of keep them calm, keep them sitting upright so that they can breathe once the seizure starts. And that's the first thing we'll do when we show up, is we'll put them on oxygen and help get that brain working again so that they can start to answer questions and it'll all start to come back together. So yes, sir.
Yeah, I saw someone have a seizure once, but I'm not sure if it was a seizure or not, but he was like speaking while he was rolling, and he was like shaking. But is it possible for for that, like the person that's having the seizure to be like talking while they're having a seizure?
There is a particular type of seizure that is a focal seizure that's specific to a part of the body, and so you'll get just a hand twitch or something really out of the ordinary that they may be able to communicate with you during that particular event. But for the full body, the full seizure like we're describing, it's impossible for them to talk. Yeah, they might make some undeterminable sounds that just grunting and noise making, but they can't communicate in any way. So if they're shaking and they're saying, "Oh, I'm having a seizure," no, they're not. They're not. There's something else going on. So does that answer your question? Okay. Okay. Yes.
My friend was having a seizure, and someone wear a wig put like an ice pack on the back of her neck, and she like woke right up. Like, does that do anything? It was like really weird.
In my experience, ice by itself does not have the power to stop a seizure that I'm familiar with. Have you come across that?
Mm-mm. Probably just the time that you got it there.
Well, it was like literally during it, and then it's happened again, and then like they put water on her, and she like it was just really weird. I didn't know that. Like,
In my experience, if somebody is having a true seizure, there's a chemical imbalance that's going on in the body that it's not like a fainting spell where you could revive them with water. So it's possible it was just really good timing that the seizure just happened to stop and sort of coincided with the application of that, or maybe that there was some other stuff going on. But in my experience, the water itself is not enough to stop or revive somebody from a seizure. So
Lights, like real, bright blinking lights, does that make them have seizures? Like,
it can. More commonly in children, they become overstimulated, and there's a lot of just that exposure to that strobe effect with games, and sometimes they'll put safety warnings on them that if you're playing a game and there's all these lights flashing, that the brain's not processing properly or it becomes overstimulated. We don't see that as much anymore, but in some cases with kids, it is still possible.
What about a diabetic seizure?
A diabetic seizure? I don't know that I've ever seen a seizure specifically related to diabetes. Have you?
I have.
The only thing that's going to fix that is sugar.
Sugar, yeah.
IV
So
sugar.
the fact that they're talking to you saying, "Get me some sugar," means they're in a diabetic seizure and not a normal
Well, that's not really a seizure, but yeah, they could be, if someone's diabetic and they know their sugar is low, and if they're able to talk and keep their airway open and sit up, you can give them some soda, orange juice, something like that.
Don't give it to them. Put it in their mouth, because they'll throw it.
Well, if they're at that point, you don't want to put anything in their mouth anyway, because then they could choke on it. So, if they're conscious enough to talk to you and are kind of with it, and they're telling you their sugar's low, you can give them some juice. The seizures that come from being diabetic and their sugar's low is not going to resolve until they get IV sugar. You don't want to put anything in their mouth. And kids also between the ages of 6 months to 3 years can have seizures when their fever just starts spiking. It's called a febrile seizure. It's somewhat common. So, if you see that, it's, don't panic. Just do what we were saying. Just keep them in a safe spot. Make sure their head's not hitting anything, and keep their airway open. And it'll resolve on its own fairly quickly.
For anybody that has kids or is around kids or has kids in the household, the water and the ice wouldn't necessarily be the recommended therapy, but for kids that are having fever seizures, the febrile seizures like Hadi was saying, their temperature is going to be elevated, and so what we do is what we call passive cooling. We don't put them in a cooler of ice and rapidly cool their body down, but what we do is we passively cool them by taking the clothes off, especially for really small children, and removing some of those outer layers of clothing that are keeping that heat in and keeping the body warm, because oftentimes those kids haven't been treated with Tylenol or Motrin or anything over the counter like that for fever. So we try to passively cool them, but we don't want to put anything directly on them because it could startle the body a little too much by taking them from very hot to very cold. So